So, hello. I think we're going live. Let me just check. Everything is up and running. Yes, we are. So, good afternoon if you're tuning in from the UK, and I guess you're just in the afternoon yourself in Canada, Gabor. How are you?
I'm fine, thank you. Yes, we just started the afternoon, and right now it's 32 degrees centigrade with a humidex pushing it closer to 40.
Oh, geez. Oh, so yeah. So this will be a nice relief from your PPE then, I guess.
Very much so. Very much so.
Excellent. Listen, thank you so much for joining me. And the last discussion we had, stress management was absolutely fantastic. And actually, most of the questions and the follow-up that came as a result of that was on the little section that we had talking about hypnosis. So thank you for agreeing to come back and
Oh, my pleasure.
have this discussion today about dental hypnosis. So I'll share a little bit about myself as well, but I'd like to first of all ask you your background. How did you get interested in dental hypnosis?
Well, it's a long story,
Okay,
but
we'll have the short version then.
I'm going to try to be succinct. Let's just say that my own personal history was such that as a child, I ended up learning uh, totally unbeknownst to me, self hypnosis. I would go into trance and dissociate continuously and constantly when necessary. It was only later on in my early high school years that I discovered what I was doing. Because I went to the public library and read all the books in the adult section on the subject matter. I then practiced on my classmates and members of my patrol and scouts. Um, when I got into dental school, the Ontario Society offered a weekend workshop for medical and dental students in third and fourth year. So I signed up. I stayed for one day out of two because they weren't teaching me anything I hadn't known at that point. It was basic inductions and a little bit of history, nothing dramatic. And while we were still in dental school, we couldn't use it because nobody in the faculty was familiar enough to be willing to supervise while you were doing this.
Yeah.
So as soon as I graduated, I went to my first official workshop with the Ontario Society of Clinical Hypnosis, and I've been at it ever since, globally.
Very,
And
very
I
good.
think you and I met somewhere in Vienna back in God knows 2000s, early 2000s.
Yeah.
Um, which is one of the reasons I enjoy hypnosis and dental hypnosis is I get to travel all over to neat places and run into interesting characters.
Indeed, and the meetings, the worldwide meetings, are a fantastic learning environment as well. They
Oh,
really are. For myself, my father is a doctor, so he studied hypnosis back in the 70s here in Glasgow, and as a kid, he would tell me stories about cases and things and techniques that he was using it with, and it just fascinated me. So he would hypnotize me as a 12-year-old. I got to experience it, and just always had this fascination with it. So again, like yourself, as a student, I was reading books. I did our dental elective on the topic of hypnosis. Actually, I came over to Vancouver to do that. Met some interesting folk, and then as soon as I qualified, I did the basic training courses. For me, though, one of the very first cases I had was a lady with extreme facial pain. She came in and we did all the thorough investigations, x-rays. We couldn't find the source of where this pain was coming from. So she was referred, of course, to the local hospital. And they did all the tests, MRIs, everything. And eventually the letter came back saying the pain we suspect is of psychogenic origin.
mm.
So I said to her, I'd basically done the first weekend training course with the society here in Scotland, and I said, I was about 23 at the time, I've been learning hypnosis, and she just gave me this look and said, I don't think so, sunshine, and she disappeared. And it was a few months later, her husband came back in and said, she's really, really struggling. She's in a lot of pain. She's been to pain specialists, pain clinics. She's had acupuncture. She's trying all these medications and nothing is helping. You mentioned hypnosis. So of course I was a bit concerned about over-promising. But I said to her, look, it has some good applications in pain control. So ask her to come in and we'll have a consultation. Now, the day that she came in, she said, look, I've come in, but I don't think I can go ahead with the appointment. I'm in too much pain today. And I said, look, let me teach you a really, really quick technique. So I showed her trance induction, got her to visit her special place. And while she was there, she imagined the dial. And in this short 15, 20-minute session, we turned the number up very slightly and then turned it down. So she left with it, a few numbers lower than she'd come in with. So she went away and we arranged the next visit. And between the two visits, of course, I'm reading every book, Hilgard, I'm phoning my dad.
Yes, yes.
And of course, she came in and I had all these techniques ready to use on the day that we were going to be doing it. And she came in with a bunch of flowers and a bottle of wine. And she said, you're going to be really annoyed. And I said, why? And she said, because I don't think I need this session today. She said, I went home and I was doing my self-hypnosis and I was using the dial. And she said, when I get to 0, is it meant to click? Is that what's meant to happen? And of course I said, well, yes, But this was such a basic technique that I'd learned on an individual weekend course, and the evidence-based part of my brain as a dentist was saying that couldn't have happened. That I can't explain how that happened. Was it coincidence? Was something else happening? And that started my journey. I thought I've got to learn as much as I can about this.
Well, when I was in dental school, the first day of second year, we had a course euphemistically called patient management. It was basically local anesthesia, nitrous oxide, and that was it. And on the first day, the professor walks in, and his practice was right across the street. So he's got a diploma in sedation dentistry. He's teaching us, and he starts by telling us there are many ways to run a dental practice. You can even read a hypnosis script and it works. You just can't run a practice that way. So there I am sitting up in the back of the auditorium going, taurine feces. Yes, you can. And I'm going to prove it. And I've been at it ever since. So it's interesting because back when I started out being trained, because I have a few years on you, the camera may not show that. I may look much younger than I really am.
Or I may look a lot older.
That could also be possible. At any rate, we were taught basically authoritarian, directive, paternalistic inductions and approaches with patients. And there, the end game was to deal with a symptom. So if we had pain, we were going to fix the pain. If we had whatever, we were going to fix whatever. Well, here we are, fast forward 40 years, dare I say. And the hypnosis world has changed. Even in dentistry, it's not about being directive. It's about communicating. Mm-hmm. And it's become about therapeutic communication from two perspectives. First, talking to the patient, so that you have to be aware of your own daily little trances and videos that spin around and autoplay as soon as you're triggered. And then you have to hear the patient, really hear them, and then communicate with them in a fashion that you maintain clinical rapport, and you can deal with the trance that they've walked in with, so that you can then give them a trance, if they're interested, that is to their benefit, that they can ultimately control, or if nothing else, just deal with the one they came in with, so you can at least talk to them. Yeah. So it's muted from authoritarianism, and it's now ramped up the volume on permissiveness and therapeutic communication, which makes a day in the office a lot easier than it would be without the modality.
Mm-hmm. Well, that's right. And I think it's interesting as well, seeing how the different approaches do often work in different cultures in a different way as well, and understanding or even just individual personality traits and characters. I know, for one thing, working with a patient who's gagging, if they are in mid-gag, and this is just an example of this, if they're in mid-gag, actually the authoritative, telling them to breathe and stay, everything's okay, is far more effective than the pat in the back, there, everything's going to be okay. I feel they need quite an authoritative approach at that stage.
It not only is that appropriate, but the late Dabney Ewan, who just died a week ago,
yeah,
he had a commentary about treating people in the ER, or you'd call it what? I watch Coronation Street and can't remember your technical terms.
A&E,
A&E, ambulatory and whatever.
Yeah.
So walking into an ER or a dental office,
mm-hmm.
you are in a hypnotic state or a hypnoid deal state. At that point, to quote Dabney, you don't need skill, you need credentials.
Yeah.
So anything you say as the guy in charge will hit home to the subconscious where you want it to be, or the unconscious, whatever we want to call it. And that's where an authoritative sleep, relax, stop, whatever you give will work better. Now, if they're perfectly relaxed and they're not gagging, if you do that in today's context and world, you're not going to get very far. So you have to know how to get through them laterally rather than attack from the front.
I can still even hear Dabney's words where he says, "My name is Dr. Ewan, and if you listen to me and do what I say, I can help you."
Yes, very much. That was Dabney, God bless him.
Yeah. And in fact, Kay Thompson had a very similar approach as well. I never met Kay or went to any of her lectures, but
I knew Kay personally, so
yeah.
She was formidable.
The recording I remember was one of her. The first thing that she would say to a patient is, "Wow, that must really hurt," and instantly the patient thinks, "Right, this person understands. They get."
Oh yes, very much.
Yeah.
Kay Thompson was historically she was quite unique. First woman dentist in Pennsylvania, first female governor of the American Dental Association. I mean, and the list goes on.
Yeah.
She was a disciple of Erickson, but she was her own person in all respects. Mm-hmm. And she was one of the few people I've ever encountered that could manipulate the English language so phenomenally to get the subtleties of innuendos and whatever to drive messages home. I've never encountered anybody else as skilled. Yeah. And I've met a lot of folks from all over God's green.
Yeah.
And Kay was when it came to dentistry, one of my favorite sayings from her is, when everything that should be done, could be done, has been done, it's okay too. Yeah. And a more profound, pithy statement I've never encountered.
Yeah, I use that as well. It's excellent. Yeah.
Yeah.
And I think these are demonstrations of, for anyone who I guess those different approaches, the authoritative approach and, as you say, this permissive approach, and both have their place and their uses as well. Incidentally, we are live just now, so if anyone does have any questions, please feel free to leave them in the comments, and we can answer any questions as we go along here as well. So obviously, you use dental hypnosis in your practice. What is it about it that you think after all these years still gets you excited and still gets you using it within your practice?
I'll give you an example. I had a lady in last week. She had a car accident about a year ago. The usual sorts of unpleasant sequelae to the accident. She's now cursed with chronic pain. And she's also bruxing. So she's a new patient to me. And I suggested to her, well, why don't you come in for a stress management session and we'll teach you some techniques to deal with it. And she came in. We gave her a half an hour. I taught her 2 self-induction techniques. Because she practices yoga, or a form of yoga, she preferred one technique more than the other. Mm-hmm. The next day, she came in for a crown preparation. Now, as we all know, crown preparations can be annoying, noisome, and if you have a joint issue, doing a preparation on 4/7 can be straining. Mm-hmm. What was interesting was that I didn't say a word to her. We put back the chair. I went to work. At the end of the session, she was amazed at how comfortable she was, how easily the procedure went, and this only through one night's practice for stress as opposed to anything else. Now, the fact that I have been able to coach somebody to deal with chronic pain, control their anxieties, and survive a really noisome dental experience without anesthetic, I might add, is something that just excites me. It's hard to describe the pleasure one gets out of being able to give somebody a life skill like hypnosis.
Yeah. And I think as well, it's, one of the things I hear people saying an awful lot when it comes to using dental hypnosis is there's this assumption that it's somehow going to take a lot of time clinically. So often I hear people saying, but I'm an NHS practice. I don't have time for using hypnosis. But the reality of it is, for the vast majority of the cases you use it with, it's going to speed up what you're doing.
Well, there's 2 ways of perceiving it. The first, if you follow the premise that most people walking in to a dental office are in an altered state of consciousness. Mm-hmm. And from what the stories I've heard about the NHS, I'm not surprised. So that being said, they're already in trance. Your job is not to get them in trance. Your job is to recognize it, and by communicating appropriately, redirect it. So that's the first aspect. So there's no great amount of time involved in redirecting trance. It's a matter of first being aware that it's there. The second feature is that if you have a totally business perspective on invested time, it's a loss leader. Mm-hmm. If I have a formal hour of coaching, and I charge nothing for it, or I charge a nominal fee, I make up for it at every subsequent appointment because I don't have to wait to get the dentistry done. Hmm. I don't have to hold hands. I just tell them to go to their happy place and ignore me unless I speak to them directly, and they're gone. Yeah. I do my thing, and then they're out the door happy. Well, what's that worth, even if I lose a few minutes up front and a few dollars, or in your case, pounds? Yeah. It does pay off in the long run. Not only one other aspect, which we never really talk about much, it's the doctor. Mm-hmm. Ask any staff member about a doctor that does hypnosis with a patient, how it keeps them happier and content, making the staffer's life that much more pleasant.
Mm-hmm. This is true. The other thing with charging and finance, of course, and I found over the years, it depends what the session is for. If it's specifically for smoking or bruxism, something like that, I did a very simple equation, which was working out what my hourly rate is. How much did I earn over last year, and how is that broken down to an hourly rate? And then I charge that as my hypnosis fee. So at least I'm not sitting thinking, well, I could have been doing a crown prep here. I'm getting paid the average of what I would have if I'd been doing my dentistry. It means I'm maybe a little more expensive than other hypnotists in town, but I kind of feel if the patient is wanting to see the dentist and have my experience, then that's what my rate is.
Well, that's a very valid and legitimate approach to putting a number on it. Most of the time, I have experienced in talking to our colleagues globally, there's two ways of employing dental hypnosis. There's the formal session.
Yeah.
That's where you book an hour of time or half an hour over several sessions, and you have to charge what you're worth.
Yeah.
Otherwise, to quote Gordon Christensen, you're worth what you charge. The other way is if I need to get a local anesthetic into a patient.
Yeah.
It's a 30-second intervention. I get the anesthetic in, and I really haven't spent any more time than I would have otherwise.
Exactly right. And these are the cases, and kids are especially good at these.
Exactly.
Kind of things. And these are the cases where the mother or the parent leaving the room will say to me, Mike, it's almost as if you hypnotized them there. And I just smile to myself and think, almost, yes.
Exactly. And for stuff like that, you don't charge because it's like the local anesthetic. You don't charge for that for a restoration. So,
but this is the thing: the parent or the patient in that situation just assumes that you are a good people person and that you said the right things, you were compassionate, sympathetic, and you knew exactly what to say when. And some people have that ability. Some people have that within their personality. There are lots of people with no hypnosis training that have got fantastic chairside manners. And when you teach rapport and communication skills to these folk, they kind of sit and think, well, I'm doing a lot of that already. Now, what I found over the years is if you already have a good chairside manner, if you fine tune that with, intricacies in language and communication skills, it just becomes so much more powerful.
There's no question. And the way I've always phrased it is doing it consciously.
Yeah.
So you know what you're doing. Now, the flip side of that is that the more you do this, the less you do anything formal and the more you become hypnotic.
Yeah.
It's just the way you are.
Indeed. Well, there's a quote from somebody in the 60s. Stolzenberg said, the more competently trained you are in hypnosis, the less you'll actually use it.
Yeah. And Stolzenberg was right. Actually, the folks in the 60s who had crummy anesthetics to work with, dulling syringe tips to deal with, and probably 18 gauge only. I kept the fellow's practice alive while he recovered from a heart attack. He still had an oil sterilizer and the sharpening stone for his syringe tips. So, for those folks, every little bit that didn't cost them any extra money was appreciated and valued. As we become more technologically advanced with what we have to offer, as some folks may know, I'm a laser dentist. Even for that, setting up with direct suggestion that you will experience tapping, air and water spray that may feel like a cold drink or biting into ice cream, and you'll hear the sound of popcorn. You set up direct suggestions, which are metaphors. The patient, if they've never had the experience, then knows somewhat what to experience, and whatever they're experiencing, they will reinterpret as your suggestions, because when they're a little bit anxious, they're in a hypnoidal state or an altered state of consciousness, depending on your terminology.
Yeah, indeed. I think, and again, I think what I love about hypnosis is it's a continuum. It's not as if you can learn hypnosis in a weekend, but what you learn in the first weekend, you can start applying immediately, and then it's a lifetime journey of learning new little techniques, and it's a fantastically enjoyable thing to be on this journey with. It really is.
Very much so. And I can honestly say that in my 40 years of professional hypnosis, clinical hypnosis, I have met some of the most intellectually stimulating, brilliant people all over God's green.
Hmm.
Um, and they're all hypnotists. And it's an area of study that has so many tangents and so many thought provoking opportunities that it's a lifetime of study and adventure. It can't be described. The only way to understand what we're talking about is to do it.
Yeah.
And to find the mystery of the subject matter. How is it that if I think X, I can accomplish Y? One of my very first patients was a 6.5 foot tall, 300-pound engineer who was absolutely dental phobic.
Hmm.
And I was doing root canal on 4/6. And it was so badly decayed that I missed all the internal landmarks, so they were barely visible. And we had opened into the alveolus. The day I got convinced of the power was when I told this engineer, imagine the blood rising up to the crest of the alveolus and turn it off like a tap. Now, what does an engineer know about the crest of an alveolus?
Hmm.
Not only did the blood stop exactly where I wanted it within a minute, I finished the endo, packed the defect, he had the tooth for another year. How does the spoken ephemeral word engender physiologic change that
Yeah.
is measurable and visible?
Yeah.
I mean, that never ceases to amaze me.
The bleeding control side of things is fascinating, and it's something I found again over the years that people will be quite skeptical of. But the way I'll often discuss about it is saying, we know if somebody has been in an accident, the first thing that somebody on the scene will do is to help keep them calm. Reducing heart rates, reducing blood pressure will have an immediate reduction in bleeding anyway. But if you think about things like, embarrassment, if I and I announce it to everybody, then the embarrassing words I use cause a vasodilation in your cheeks and a flushing of the cheeks. And that's words causing vasodilation. A very base example of it.
Yeah, and this is one of those little mysteries that has fascinated me since the day I started.
Yeah.
Never mind anesthesia and all of the other neat things you can accomplish with this. So it's a lifelong study, and it never gets old
Yeah.
or boring.
So obviously within your work, you're using hypnosis a lot to help folk control anxiety and help them relax, controlling stress. What are the other kind of main things that you would say you're using it for, I guess, in a day-to-day way?
I've over the years I've used it for anesthesia, done extractions, worked with chronic pain in the trigeminal neuralgia patients and such. I've used it for bruxism, gagging occasionally, um, but mostly 90% of the time it's just about communicating with people and realizing that they're in an altered state. So,
Yeah.
what's the message that we have to slip in to get them to be more comfortable?
But I mean, another great example of that is using hypnotic techniques alongside sedation.
Oh, very much.
What a phenomenal combination. It really is.
If you consider the reduction in sedatives that you use,
Hmm.
that in and of itself is massive.
Yeah.
How you doing, Marcello? Um, that in and of itself decreases your liabilities and the morbidities for your patient.
Yeah.
I mean, what more could you ask for then? And there are enough Scandinavian studies that show that a combination of hypnoanesthesia um, gives you a faster recovery time, decreased morbidities, and is a cost savings to health insurance.
Oh, of course, yeah, yeah.
Well, what more could you ask for then?
Yeah. That's the thing. I mean, I see a lot of bruxers, as you say, gag reflex as well. So people denture intolerance or even just procedure intolerance, smokers as well, of course, very effective so long as they are motivated and
Yes.
keen to stop. Then, you know, the one alarm bell is if a patient comes and says, "Mike, my wife said that I have to come and you have to hypnotize me so that I stop smoking." It ain't going to work.
There's absolutely no doubt about that.
But you know, as you know, pain control, anxiety management. You know, as you know, a few years ago, I did. I've done a number of cases that were televised. You know, including one that was on BBC's Horizon. But I guess the ones that people have seen more were the implant placement cases.
Mm-hmm.
And you know, my rationale and my thinking behind allowing myself to be filmed in these cases was really to. I was very conscious. I didn't want to come across as this crazy dentist that's saying we should be placing implants with no anaesthetic. The whole point behind it was if we can prove that implants can be placed without local anaesthetic, imagine how powerful these techniques are if you use it in combination with your local anaesthetic, in combination with sedation. And that's really where it comes into its own.
I don't know about you, but I've had patients over the years that I was the last port of call.
Yeah.
They couldn't take local anesthetic. They couldn't be treated in the conventional manner.
Yeah.
So at that point, what are they going to do?
Yeah.
And so being filmed, I call it proselytizing for the faith. The more we can go out there and talk about the subject, I think the better it is, because why not have people re-encounter their own innate abilities to heal themselves, to help themselves, when they have to encounter the likes of us, or any other condition for that matter, any other medical context.
Indeed. And as I say, learning hypnosis, it just flows into every part of your practice, from the layout of the patient lounge, you know, your decor, the way that your staff are greeting patients. You know, our post-tooth removal advice sheet is all written with hypnotic language. I think the opening statement says, now that the tooth has been removed, the healing process has already begun. And the rest of it all flows with very similar kind of positive healing kind of language.
Mm-hmm. Yep.
I'm happy sharing that with anybody that's interested. So just send me a direct message. Also, I guess if anyone is watching this and is interested in studying hypnosis, you know, we had a bit of a conversation before we went live, talking about where people can source hypnosis training. And I guess that's kind of confusing because there are so many different places and organizations available. I think the main advice I would give people is to look for an organization that is run and managed by healthcare professionals. So doctors, dentists, psychologists. Certainly within the UK, we have in Scotland the British Society of Medical and Dental Hypnosis Scotland, and there is also BISCA, British Society of Clinical and Academic Hypnosis. My advice, if you're in Europe, would be looking for a society that is somehow affiliated with the European Society of Hypnosis. But in North America, can you explain again just the situation with
Sure.
the societies?
Each of the provinces and states tend to have a clinical society of hypnosis. So check out and see who's in your backyard and get their initial training. Most of them will be component societies of the American Society of Clinical Hypnosis. There is also the Society for Clinical and Experimental Hypnosis. And everybody belongs to sort of everything, and everybody knows everybody. ASH tends to, that's the American Society of Clinical Hypnosis. They tend to have about 6 or 8 workshops around the country every year, plus an annual meeting, which is all workshops. It's broken into 3 levels: beginners, intermediate, and continuing or advanced. The other thing that one has to make mention of, and I don't think you disagree with me, there are a lot of lay hypnosis societies. The National Guild of Hypnotists, for one, they tend to be the largest and most globally expanded group. In terms of hypnosis, it's a skill that everybody has innately. Nobody owns it, nobody can direct it. So if I want to teach and use hypnosis for entertainment, there's absolutely nothing wrong with that. But if you're going to use hypnosis in clinical practice, you want to be taught and trained and belong to a group of clinicians. There are many, many reasons for it, from the ethics of it to the liability of it. But it's kind of very simply put, if I need an appendectomy, I'm not going to have my auto mechanic do it for me. So if I need help, which at a fundamental level is a psychological intervention, then I'm not sure the stage hypnotist is the person to get the therapy from. Or as we had one here years ago, the person with the bachelor's degree in history was offering hypnotherapy. You may be able to tell me the history of hypnosis, but what skill have you got dealing with an anxiety disorder or chronic pain or something of the sort? So it's the application of hypnosis that's difficult, not hypnosis itself.
Yeah, yeah, I would agree. Yeah. So certainly, if anybody watching is looking for some advice on first steps, feel free. If you want to direct message me, I'm sure Gabor would be happy as well. Just drop us a message and ask. Tell us where you're from, and we'll do our best to point you in the direction of some of the options that are there for you.
Drop us an email.
Yeah. Yeah, more than happy to help. And certainly something we obviously have been talking about in the past is potentially setting up some form of mentorship program for anyone who's interested. And I think if we're going to do this, it would be for people that already have a base training in hypnosis, and it would form, I guess, it would be formed around the many, many years of experience that we have, and in sharing as much information as we can.
Definitely. And it would be aimed at the dentist rather than, or even the hands-on physician if they're interested, because the world now has drifted to a more psychological perspective and utilization of hypnosis. And those of us in the hands-on professions are occasionally left out of the mix. So to have a specifically dental perspective can be of benefit to those of us that use it, if for no other reason than just to exchange ideas.
Yeah, absolutely. So watch this space, folks, and we will get our heads together and start forming some ideas as to how a dental hypnosis mentorship program could work. What I would suggest is if you're interested, then again, get in touch. Let us know that you're interested as we start to prepare some ideas. But you'll hear more from us on that topic. As we consider it all. We've got Marcelo here saying that he wants us to come out to Uruguay for a mini hypnosis congress. So that sounds like a lot of fun.
That would be a really good time as soon as I can get out of the country.
Indeed. Good. So we've got a couple more minutes to go. So again, anybody that has any questions, feel free to jump in. But it has been fantastic chatting to you, Gabor. Thank you very much for.
Oh, you're welcome.
Taking the time to do that. And I guess the hard thing here was in keeping this fairly contained and fairly short. I think we're now approaching 40 minutes. I know that we could be chatting away for hours and hours on end on these topics, but we're obviously hoping to put together something relatively short just to give people a bit of a flavor as to what we do and why we do it in the world of dental hypnosis. So, I think you've frozen there. Oh no, you're back.
I tune out occasionally.
I was blaming the computer, not my dulcet tones.
Don't take up singing as a profession. At any rate, please get a hold of us. Drop us a line. We're more than happy to communicate, share, and organize.
Absolutely, whichever stage you're at in the journey, and with your interest, more than happy to point, even if it's pointing in the direction of a good book to read on a particular topic, anything like that. I think, and again, I think that's one of the things that, as you say, that I've really taken out of the hypnosis community and going along to conferences and events is just how sharing people are with their experience and their ideas. It's fantastic. Folk, it's a phenomenal group of people to get acquainted with.
Hypnodontists are a unique breed that love to share their knowledge and their experiences, which makes them an interesting group to hang out with on a good day.
Indeed. Good. Oh, there we go. So just a thank you coming in. Thank you very much. Good to know there was somebody out there. That's always encouraging.
Yes, it is.
Yes, you sometimes wonder when you're doing these things, is it just you and I chatting away to the ether? I don't know.
My buddy Ashley Goodman, who is currently the vice president of the American Board of Hypnosis and Dentistry, he and I spent an entire 8 hours one day talking to a microphone at a American meeting where nobody wanted to come and play with the dentists. It was really quite surprising.
There you go.
So I've had that experience. I know what it feels like.
Indeed. Well, listen, it's been a real pleasure, and I think, listen, we'll do this again. We've and the great thing about these talks as well is this will stay up on YouTube, so this is going to be there, and people will watch it again, even if it isn't live. But if we have another discussion again in a month or so, anybody can come on and ask any questions. As I say, I think the Q&A part is quite an interesting experience, so I'm quite up for answering some live questions on the topic of dental hypnosis, just as long as they're not too difficult.
In my case, you have to shut me up, so ask the question. I'm happy to respond.
Yeah, no, I've had the mouse poised over the mute button, but I've not had to press it yet, so it's been okay. Excellent. Well, thank you very much again. And as I said, please, anybody, please get in touch. Send a direct message through Facebook, and look out for what training organisations are in your area. As I say, in Scotland, it's BSMDH Scotland that I'm involved with the teaching. And watch this space. Dental hypnosis mentoring program is going to come this way very, very soon. So get in touch if you're interested. Okay, thank you, Gabor. I'll let you go.
You're welcome. Have a good one, all.
And cool down in your 32-degree heat. So you might need some hypnosis for suggestions for coolness.
I'm already visualizing drinks with little umbrellas. So
fabulous. Okay, thank you very much. Stay safe. Goodbye now.
Bye-bye.